one thing is really important. Night pain is the key. So now we're going to cover frequently asked questions about musculoskeletal physiotherapy, what I ran into quite frequently. What is physiotherapy? Physiotherapy is a part of social and healthcare area when we are focused on the moving and the maintenance and reducing the pain. During the physiotherapy sessions, we might use guidance and counseling. We can use therapeutic exercises, and also we can use different kind of manual approaching, for example using the fascia method or similar like that, or joint mobilization. But the big aim is to increase the health, prevent issues, and get those symptomatic areas going to the better, so they won't be causing that much issues, causing the pain or dysfunctions of the joints or in overall health. What kind of help can we get from the physiotherapy? Physiotherapy focus on different musculoskeletal issues, and typical reason why people go to physiotherapy are neck and back pain, joint issues, for example knee, hip, shoulder or elbow pain, and also there is these issues what is caused by really stiff and tensioned muscles. In physiotherapy we can reduce the pain, improve mobility and improve functions. So the point is to get yourself faster to the regular pain-free situation after, for example, surgeries or accidents. What do we do in physiotherapy? The session always starts with the discussion with the clients. What is the issue on the background, how it started and how it has developed. After that we need to have some sort of examination so we can figure out what is the causing the issues. And typically those treatments might be, for example, increasing the range of motions in the joints, doing the fascia treatments or massaging the different areas. We can use the taping, and most of the cases we need to have some sort of specific exercises and guidance how to reduce the issues. Best results can be done when we combine active therapy, manual treatment and guidance. The client's targets might vary from the reducing of the pain to get themselves to the better working condition or get rid of the issues what is caused by the fraction or different kind of traumas on the background. So rehabilitation of the issues. Do you need prescription to go to physiotherapy? And no, you don't. So you can put yourself time to the physiotherapy without that. Nowadays it's quite common that people attend to physiotherapy first because it's saving the time, it's saving the cost, and after that you will going to get yourself treatment plan how to get yourself into the better situation. But for example, doctor's description might be helpful when we are thinking about longer term goals, or if there is for example fractures or traumas on the background when we need to have the paper from the doctor. Can you get refunding from the visits in physiotherapy via KELA? Yes, you can have it. From the starting of 2025, KELA has brought back this option, so you don't need doctor's prescription to go to physiotherapy, and still you can get yourself small refund from the visits. You can visit 4 times in physiotherapy, and from one visit you can get 15 euros back per visit. But remember, that is only allowed to 4 visits per year. Can the insurance company pay for the physiotherapy visits? In many cases, yes. For example, if you have a trauma on the background or there is some sort of car accident, typically those are covered with the physiotherapy payments. For example, if you have a prescription from the occupational health care to physiotherapy, then the insurance company or health fund might pay the visits in physiotherapy. So typically you will going to need prescription from the doctor, and you need assurance from the insurance company maksusitoumus that they will going to pay the bills. Typically, the insurance company has these agreement places where you need to have your physiotherapy. If you don't want to go in that kind of places, you can choose the spot where you want to have your self-treated. But after that, you will going to get a refund from the insurance companies. But make the agreement possible first, so always check the maksusitoumus because you need to have it covered before you go to the physiotherapy. What is the difference between the massage and the physiotherapy? Typically, when you go and visit the massage therapist, you will going to get yourself treated, and nowadays they are guiding the staff to do how to prevent the similar issues going back. In physiotherapy, we usually attend to go to the direction where we need to guide the clients to get rid of the problem on the background and how to get it solved. Massage is excellent way to get yourself relaxed and, for example, good way to treat minor pain feelings, so you can get yourself reduced concerning about that. But, for example, in physiotherapy, we will going to focus more if the symptoms keeps coming back or if you have some sort of chronic issues on the background. For example, you can think the massage as a car maintenance ideology. Older the car gets, the more maintenance it needs. So, in that cases, if you want to train yourself really hard, you need to have good ways how to recover from the training, and massage is excellent for that. If you have pains, should you preferably rest or do active movement? Typically, it's easier to stay active because, for example, if we think about most of the low back pain cases, staying active is the best way to get rid of the issues. Longer periods in passive, for example, laying down on your bed all the time, it doesn't make the overall health go better, so overall health goes better when you start moving. In some cases, minor recovery period might be beneficial, but in big picture, the activity is way more better. If you start having resting pains during the night, what blocks your night sleep, that is the thing what we need to get rid of. So if something is causing the night pains, then we really need to get rid of that. One thing what you need to remember from this video, night pain is the king. So how to get rid of it? Can muscle be sore after the physiotherapy visit? And yes, they can. Typically, when you go for the physiotherapy, you might end up in a situation when you need to do some sort of exercises or you will going to get yourself some sort of treatment. So that is quite normal that you will going to get 2 or 3 days after the visit some sort of resting pain what is quite mild. But this is typically a short period and it will going to eventually go away. And if you have questions about what is the normal pain after the visit, then you need to consult your physiotherapist because they will going to tell you what is the issue on the background and what is normal pain after the visits. Will you going to get exercise program to home from the physiotherapy visit? And typically yes. When you go for the physiotherapy visit, you will going to get always some sort of guidance how to get rid of the issue. So there will be, in most of the cases, some sort of exercises. The issue is that we need to guide you to do the stuff in regular everyday activities so you can do really easy exercises between the physiotherapy visits and get yourself back on the track, reducing the issues. Can you avoid surgery with the physiotherapy? Yes, in many cases, yes you can do. For example, if we check the results concerning about the shoulder or knee issues, typically we can reduce the need for the surgery from physiotherapy. And that is quite often the best way to get yourself treated because when you go for the surgery there is also a risk about the sleeping and other factors. But in most of the cases it's always individually checked out who will going to get good benefits from the surgery, who will going to get good benefits from the physiotherapy, and it always goes case by cases. How to treat your own issues and get rid of those. To understand the problem on the background, we need to have a good idea from the pain mechanisms and how they differ from each other. If you want to have more guidance on that, check this video.